Well, morning everyone. I'm really grateful to have this opportunity to come and speak to you. So I'm here as co-founder of Plant-Based Health Online, which is a new CQC regulated healthcare service here in the UK that focuses on healthy lifestyle habits. So we use an approach called lifestyle medicine, and you'll be hearing from my co-founder Laura Freeman a bit later in the week, in fact probably tomorrow, about what that means in terms of lifestyle medicine approaches. But my route to this approach to healthcare and well-being is as a cancer doctor. So I've had a traditional training in medicine. I qualified back in 2000 actually, 21 years ago. I trained in medicine, and then I did specialist training in haematology. Then I've been looking after patients with lymphoma as a consultant at King's College Hospital since 2012 actually, so quite a while. But you know, through my own experience of transitioning to a plant-based diet and learning the science around healthy eating and diet and how that can impact health, I came to realise that there's a lot that we could be doing to improve our chances when it comes to cancer. And it really helped me to communicate better with my own patients as well, because when I sit in clinic and deliver quite life-changing news to my patients, there's sort of a set list of questions that virtually everyone asks me at some point, whether it's at their first appointment or once they finish treatment. And it's always around, is it something I did? Is this genetic? Could my family be affected? Is there anything I can do to improve my chances, going forward after treatment's finished? And what about supplements? And there's some really clear answers to all these questions. And I think that there isn't a great deal of public awareness, or it's not in people's consciousness all the time, that there are some really active things we can do to help us, kind of fight this fight against cancer, because cancer is now the second top cause of death in the UK. It's actually the commonest cause of premature death in the UK. So, more than 40% of deaths before the age of 75 are due to cancer. And the main cancer types we're talking about, unfortunately, still include lung cancer. And I'm not really going to cover tobacco smoking today, because I think that finally has reached our consciousness and we understand that tobacco smoking is not good for our health. But the other top three cancers are breast cancer in women, prostate cancer in men, and colorectal cancer in both sexes, actually. And quite a significant proportion of these common cancers could be prevented. And even if you have a diagnosis, the good news is that you can really improve your chances of remission and surviving well with a good quality of life by adopting some relatively straightforward lifestyle habits. And so from the Cancer Research UK and other international organisations around the world, we know that 4 out of 10 cancers, so 40% of cancers, could be prevented. Tobacco still remains the top cause of cancer in the UK, but second to that is being overweight, and that contributes to about 5 to 6% of cancers globally and every year in the UK. Not eating enough fruits and vegetables, that's another top cause. The only foods that really protect us against cancer are the healthy plant foods, those vibrant, colourful foods, essentially fruits and vegetables, but also whole grains, which are full of fibre and nutrients, and beans, and I'll come back to that. Safe exposure to the sun's important, getting that balance between enough vitamin D and obviously keeping your skin safe depending on your skin tone. And alcohol, I don't think the messaging is right about alcohol consumption. Alcohol is a toxin at the end of the day. Like with everything, there's a dose response. So, drinking a little bit may not have a direct impact, but the more you drink, the worse the effects. And actually, when it comes to cancer, there is no safe limit. So even adding in, 1 unit of alcohol a day or a couple a week will impact your risks of cancer. small percentage, but it's all cumulative, isn't it? So I'll come back to that also. And then physical activity, everything we say about healthy diet, about protecting, reducing inflammation and protecting our genes and our chromosomes and affecting gene expression could be translated exactly the same way to regular physical activity. They're just equally important to incorporate into your daily routine. And so when we look at the stats, they're fairly startling. Actually, April is Bowel Cancer Awareness Month, and we could prevent more than 50% of cases of bowel cancer, which is pretty phenomenal, really. And that's if we started to eat enough fibre. And we all know that fibre only comes from plant foods. And, at the moment in the UK, most of us are only eating about 18 grams of fibre, and really we need to be eating 30 grams, if not more, of fibre a day. And to get that amount, your plate has to be pretty much loaded with the healthy plant foods. Another top cause is eating meat, and I've got this directly from the CRUK website. It says caused by eating meat. 13% of bowel cancers are caused by eating processed meat, and that's UK stats. It's around 5,500 cases of bowel cancer a year. Could be potentially wiped out if we got rid of processed meat. And about 11% are caused by being overweight. And similarly for breast cancer, being overweight and excess of alcohol are the top sort of risk factors there for breast cancer. But it all stems back to the healthy lifestyle habits, diet, physical activity, restorative sleep, managing stress. They all impact on our body processes, our weight management, and the cellular stress that then ultimately leads to cancer. And the troubling thing is, particularly for colorectal cancer, that it's occurring in younger and younger people. Although bowel cancer screening, which is sort of an early detection method, is helping us to prevent some cases, it's only for older adults, and actually the biggest rise in cases is in people under the age of 50. And in this short time period where it's become more common, the only thing we've really changed radically is our environment, our food environment, our physical activity environment, our exposure to toxins. So I think that's something that needs to be addressed pretty quickly. And there's a lot of studies telling us how much of an impact we could make for our risk of cancer and our risk of dying of cancers. I just mentioned one study because it's really powerful data. It's from the US. It followed more than 170,000 men and women for over 30 years, and they looked at 5 healthy lifestyle factors. So healthy diet, so predominantly plant-based, low in red and processed meat, low in processed foods. It looked at healthy weight, whether you smoked, moderate alcohol rather than excessive, and physical activity. So that's 5 lifestyle factors. And after 30 years, they found that just by having a high quality plant predominant diet, you could reduce your chance of dying from cancer by 30%. I mean, that's pretty phenomenal. And then if you had all 5 healthy lifestyle factors, you could reduce your risk of dying from cancer by 65%, which is amazing, really. And the good news is that you'll hear during the week that these healthy lifestyle factors are not just important for cancer, they're the same ones that give rise to cardiovascular disease, dementia, type 2 diabetes. And actually, I've just posted this morning on my Facebook page, a big study from the US showing that 70% of cardiovascular disease could be wiped out if we address some of these healthy factors.